This is RegisteredNurseRN.com, and this video is going to be an overview of wound care nursing. And wound care nurse is a relatively new position in the medical field. For about the past 30 years or so, many certified wound care nurses have helped patients maintain excellent wound care, and it's filled by thousands of nurses today. There's a great need for certified persons to fill the positions in hospitals and clinics around the world for wound care specialties. And becoming a wound care nurse can provide an extremely rewarding career for the right people. And again, we're just going to give a brief overview of the description, the certification process, and the salary and job outlook for this. So, first of all, the description. Wound care nurses can go by many names, including continence and ostomy nurses. And these nurses specialize in the proper management of wound care by treating and monitoring wounds that are the result of disease, injury, or medical treatments. The majority of the positions for this type of nurse are in nursing homes or hospitals. Some nurses also work in positions that require them to travel to the homes of patients to care for their wounds in the home. And the job requires that these certified nurses provide care that will quickly and safely heal various types of wounds, including surgical openings, ulcers, bed sores, feeding tube sites, and abscesses. Their work requires that they access the wounds, create and implement treatment plans, and monitor infections and signs of various infections. And they also clean wounds. And the nurses must also have the skills to notice symptoms that require surgical drains or surgical debridement. They must also handle wounds of patients respectfully and delicately. And wound care nurses may also educate others on the proper area of wound care. As far as the certification, before earning a certification to become a wound care nurse, it's necessary to receive the proper education from an accredited college or university. And educational options for entry-level positions include a diploma from a qualifying hospital or educational institution, an associate's degree, or a bachelor's degree in nursing. And a bachelor's degree offers the greatest number of employment opportunities because you do get that 4-year BS in, and so you gain a little bit more skills, and that opens up a little more opportunity. But you can become a wound care nurse with just a RN diploma or ADN degree, assuming that you are licensed in your state. And earning that certification is very important if you want to increase your marketability and salary potential. Certification is the evidence that you have achieved a mastery of the skills to become a wound care nurse. And there are several organizations that offer a specific certification in wound care, including the National Alliance of Wound Care and the National Academy of Wound Management, as well as the Wound Ostomy and Continence Nursing Certification Board. These and other certifying organizations require that candidates earn 2- or 4-year degree in nursing and successfully pass the national licensing exam to become a registered nurse. And experience or completion of an accredited wound care program is also a requirement to sit for the examination. So that's something you want to keep in mind. As far as the salary, what kind of salary are you going to make as a wound care nurse? Well, because they do have that little extra certification and it's a relatively new area of nursing, they usually earn more money, a little more money than just your average RN. And so, again, there are some unpleasant aspects of being a wound care nurse, such as the smell and sight of these untreated wounds. It can be a little overwhelming for some people, and so for that reason they'll make a little more. As far as the average nursing salary, you can expect around $62,000 annually. Now, that's a nationwide average. It could be higher or lower depending on where you live. If you live in a large city, it could be higher. If you live in a small, isolated town somewhere, you may not make that much, but about $62,000 is the average salary for this type of nursing. And you can increase this number by $10,000 to $20,000 or more annually if you gain experience and maybe additional certifications and so forth. And as far as the job outlook, it's a great outlook. There's still relatively high demand for this position, and it's expected to increase between 10% to 27% over the next decade. And again, because it is a little bit more of an area of nursing that requires a little bit of a special person to do that, you're going to get paid a little more, and there's going to be a pretty steady demand in most cases for the next decade or so. So if you're interested in wound care nursing, we'd like to invite you to come to our website, RegisteredNurseRN.com. We have a lot of articles to help you pass nursing school, to help you find different specialties in nursing, to help you advance in your career if you're a current nurse right now. So definitely stop by our website and bookmark it or subscribe to our YouTube video. Thank you so much for watching, and have a great day.